So therefore, the potentials on the card may be measured on link. So Alexei group is here. Alexei group, right? Come in. So the electrodes may be laid on the arms and legs. So it is done. And the idea is that the cells are depolarized in the heart, not simultaneously. As you know, the pacemaker is in sinoatrial node. Therefore, the atriums are depolarized first, right? And at that moment, the heart is like a dipole. One part, the auricles are depolarized, the ventricles are not depolarized. So this is the origin of ECG. The dipole, which may be reflected on the using the potentials of the limbs. So therefore, we will use this electrode placed on the limbs, and we will try to register the ECG. Now, right? Who wants to be the patient?
Go.
Take a seat, please. So we will use this solution. This is sodium chloride. This is electrolyte. To induce the conductivity, and you see the letters. Right, the first electrode will be laid on the right arm here. The next electrode, L, is this one, L. This is like street lamp, red, yellow, green. Okay, and then on the legs, on the legs. So please lay down the electrodes on his legs. The right leg negative, ground, black one, and green, you see F, foot, on the left leg. So now we are ready to begin the registration.
No. Left, correct.
So this is routine ECG electrode placement.
Yeah.
Also we can use sometimes chest electrode 6 V1 to V6. Now we will not use them. They are reflected with this V lamps here. So if we are ready, then we ask you to relax. Think, dream about Malaysia, completely relax. Yeah. So we will turn on the equipment like this, and this is his pulse rate. He's nervous. Look, 140. Oh, this is tachycardia. Okay, it's a little bit less now. We will. The sounds reflects his. So keep silence. The sounds reflect his heart beatings, and I will use filters. Two filters, to reduce noises. And 25 millimeters per second is normal velocity of paper. So we will try to register his ECG. So completely relaxed. Okay, ready. Now look what we have. It was a program. The program that changes automatically the leads of ECG. So this is first standard lead, second, third standard lead. What does it mean? First lead is the action, the difference of potentials between the left and right arm. This is first lead. Here it is. The second lead is the difference of potentials between the right arm and left foot. And the third standard lead, 3, you see number 3, is between left arm and left foot. And you see also 3 additional amplified leads, AVR, AVL, AVF. What does it mean? It means, for example, AVR. The right arm is taken and the opposite point is combined potential from left foot and left arm. So they just combined, and this point, average point, is used as a reference point for right arm. Understand? The same thing for AVL and AVF. For AVF, left foot is taken and the potential is combined from right and left arm. So what we see is the waves on ECG. We see P wave, for example. This is very nice picture, very elegant. The tachycardia. So, but you see the high frequency of heart beatings.
Just now I ran.
Just
now I ran.
Run. You used to run, but I asked to dream. So the first. He ran to the class, I think.
Yes.
So, okay, this is P wave, the first P wave, then QRS complex. This is the ventricular complex, which, okay, and this is T wave, so ABC, P, Q, R, S, T. P wave, the first wave of the ECG reflects the depolarization of auricles. Depolarization, not contraction. So I ask you to take it into consideration. The QRS complex, you see the amplitude is highest. It reflects the depolarization of ventricles. In ventricles we have the largest amount of cardiomyocytes. That's why the amplitude is highest. And T wave is reflecting the repolarization of ventricles. So this is the whole picture. You should analyze when you will be a doctor and when you will use ECG for estimation of the activity of the heart. Sorry. You will estimate the durations of segments and intervals of the ECG, for example. For example, PQ interval or PQ segment, better to say, should be not longer than 0.2 seconds. If it's longer, it means that there is the blockade of the heart, because this segment reflects atrioventricular delay. You see, please keep it into your book, that it is crucial for the cardiac cycle, for the normal cardiac cycle. The auricles and ventricles should contract separately. Да, Леш, ну чего, я демонстрирую ЭКГ твоим и своим студентам, что? Давай. So, then QRS complex should not be longer than 0.1 second. It's not longer than 0.1 second. Then you should analyze, you should see the frequency, or here it is automatically given, 134 pulse rate beats per minute. Also rhythmicity, you should look for extrasystoles, probably they may be present on the recording. And also the amplitude of the waves. So I told you already, the highest wave is wave R. And you can estimate the electrical axis of the heart. So if the electrical axis of the heart is normal, oblique, slightly oblique, then the highest amplitude of R wave is on the second lead here. It's normal position. But you may see that in this case the tendency to high R wave in the third lead. It means if the third lead R wave is high, it means that the position of the heart, the axis, electrical axis of the heart is turned to the right. It reflects the vertical position of electrical axis of the heart. Because he is asthenic, and it's normal for him. If the R wave is high in the first lead, it means that the position is turned to the left. It may be found in people who are hypersthenics, who are short and fat. and fatigue, and it may be also due to the training, physical exercise, when there is hypertrophy of left ventricle. When person is working, doing sport, his heart pumping lots, the volume of blood increases, should work harder, and the volume of heart increases. And also it may be a sign of hypertension, because in patients with hypertension, left ventricle should also do the increased work to pump the heart through the system. Understand, right? There will be also the shift to the left, horizontal position of the heart. Then, okay, this is ECG, it's good, but you see, you may understand that if you are a patient and you visit a doctor is a pretty young lady in shirt, and you may be nervous, he is nervous now. This may not reflect his normal activity of the heart. It may be a reaction to the white coat, as we call it. The white coat, it produces the effect on the patients, always. It may increase the blood pressure, etc. Therefore, the improved kind of registration is called the daily monitoring or the Holter monitor, when the electrodes are placed on the body, and the data is collected during the day and even during the night. So then patient came to you, you just put the flash card into the computer, and you may analyze the changes of blood pressure of ECG when he is doing his ordinary normal activities, when he is driving car, when he is speaking with his wife, with the boss, sleeping, and so on. Then you can analyze what happens during the day, what is the dynamic of blood pressure, and what happens with ECG. So it's, of course, better. By the way, the modern cellular phones, they are equipped with such function. Galaxy 4, for example, you may bind the band, collect data during the health monitoring. Understand? But the analyzing of ECG is rather an art. You need to train a lot to see what happens. But on the therapy, you will learn what happens during infarction, for example, myocardial infarction with ECG. For example, T wave predominantly reflects the myocardium the disturbance during infarction. The T wave shifts from the baseline. It may change the position, not up, but may turn down. But it is not my task. The Department of Therapy will learn you what happens during such problems with ECG. So today you have to do several experiments. Second, 11.2 is with ECG. We will use this recording. This is for group of Alexei. For example, you will